Welcome to our discussion on the transformative role of Global Capability Centers or GCCs in driving industry innovation. I'm Gautam Srinivasan, and today we will explore how GCCs in India are evolving from traditional back office roles to becoming hubs of innovation. They are significantly contributing to the economy by generating $46 billion in revenue, with projections to double their GDP share by 2030. Recent reports highlight how GCCs are embracing open innovation models by collaborating with startups and other external ecosystems. Now, this approach allows them to remain agile, co-create solutions, and scale successful innovations, ensuring sustained business transformation and growth. One of the most prominent GCCs is Optum India. Now, Optum India is the global capability center of United Health Group, a Fortune 4 company committed to helping people live healthier lives and helping make the health system work better for everyone. With over 2 decades of presence in India, Optum India delivers quality outcomes across the continuum of healthcare. They drive innovation by integrating healthcare operations capabilities and advanced data analytics and technology solutions to enable a simpler, more accessible and affordable health system for the consumers they are privileged to serve. Now, to discuss how GCCs are now focusing on value creation, moving beyond their traditional roles and playing a strategic part in their parent companies' innovation journeys, we have Harish Gudi, Senior Vice President of Technology at Optum India. With over 3 decades of extensive experience in client relationships, large-scale delivery analytics and management consulting, Harish leads the India Technology Organization at Optum. He focuses on developing and implementing long-term growth strategies centered on delivery efficiency and innovation. So let's meet Harish for an in-depth conversation. Join in. Well, here we are with Harish Gudi to talk about the value creation aspects of GCCs. Harish, great to have you with us.
Very good to meet you.
How's the Josh?
Fantastic.
All right. Harish, I first want to understand the journey of GCCs and their transformation of their role itself from, say, cost arbitrage centers to innovation hubs. Take us through this journey.
Oh, Gautam, that journey has come such a long way. Gone are the days 10-15 years ago where it was about cost arbitrage and all that. Today, GCCs are front and center and a fully integrated part of the enterprise, innovating across various things, whether it is in products, lines of business, product growth, across functions, across industries, aerospace, oil and gas, retail, healthcare, pharma, financial services, banking. I can go on and on. Not just that, a lot of GCCs have pivoted into creating center of excellence where deep engineering skills, deep product skills and innovations are being led from India by these GCCs. If you look at the NASSCOM data, right, 2022, 200 billion was the IT industry in India. The projection is that by 2030, we will be about 500 billion.
Wow.
And GCCs are expected to be 20% or more
Of the revenue potential.
of this cake. So that's going to be really, really big and a lot of opportunities for people.
So in a sense, the back end and the front end, those lines are getting blurred, or back office and front office.
So there is no concept of back office and front office anymore. These are integrated business units that are helping create innovation and drive innovation.
All right. And in terms of controllable SLAs, executing business, those aspects, what would
That's
you
a
like
given, right? Because if you want to deliver to the value that the enterprise is looking for, to the priorities that the enterprise is driving, everything has to be controlled through quality, through SLAs, to deliverables, like you would do in any organization across the globe.
And it's end-to-end product development excellence, all those factors make it a default mode of operation in the world that we live in.
There is no other way to do it. And I just want to emphasize on the fact that many of the GCCs are now coming out with go-to product market, go-to-market products. That engine is moving really, really fast, and a huge number of innovations and products are being delivered from India that are fresh, net new to the market.
All right. Now, in all of these points that you have discussed, I want to understand how does the culture factor come into focus? Because when we're talking about innovation, culture is going to play the role of a cornerstone to make sure that all these initiatives deliver the value that they should. So, what would you say on this whole culture aspect, especially from the healthcare perspective?
So look, from a healthcare perspective, what is it that matters? It is that person at the end of the claim, at the end of the benefit, at the end of the physician that we are trying to serve. That's the person that we are innovating for. And hence it cannot be some sporadic transactional innovation. It has to be deep rooted, well thought out to make the difference in the life of that person. In short, make the health system work better for everyone.
And about the innovation mindset, what would you say? Because you're also looking at changing core business processes. So how do you develop that innovation mindset?
First of all, it's very, very important that people understand business and the technology and bring it together. We have an entire initiative in our India offices where the operations and the technology teams are sitting together. And we run this entire initiative, which is a zero distance initiative called Sit with Ops.
Okay.
What better can you do other than sitting closest to your consumer and your user that you also have internally, who's facing the day-to-day challenges, taking the calls from the consumers and the patients and the physicians and trying to solve problems for them. That is where you see where the friction is. And then you can do deep-rooted, grounds up, zero distance innovation. So that's the culture that we are building here.
What's the implication there? Let's say clinician and patient relationship, right? How does this mindset change the pain points that in this subset between the clinician and the patient, these issues which come up? How does the innovation mindset help overcome challenges?
See, there are two types of pain points. One is the pain point of the advocate who is trying to either service this clinician or the patient, which is the friction point that I talked about. There is a second aspect of, is the clinician able to dedicate the time to the consumer and the patient to where it belongs? So we do a lot of clinical analytics, decision making help to enable the physician and the clinician to focus on what matters, which is taking care of the patient, instead of spending a ton of time taking care of administrative work.
Leaves the bandwidth free to do whatever they were meant to do.
What
right?
they're supposed to really do.
All right, Harish, let me bring you into the conversation. You are a technologist, vast amount of experience in this space. So I want to understand from you, what are the innovations that excite you, and what do you think has the potential to revolutionize the way we look at healthcare? Usually seen as a very analog space, but it has seen tremendous amounts of transformations recently.
See, we can talk about pure technology innovations till the cows come home. But to me, innovation bears fruit when you're keeping, again, the consumer in your mindset and working for him or her. Which means, how do I make consumers' lives easier? By them being able to look up their condition, look up physicians, look up prices, be able to fix appointments, the standard things that everyday people are used to. How do I bring all that to the healthcare industry? I think there's a lot of innovation that's surrounding that needs to be done. Second, people are becoming very aware of health. They want to do their best about their well-being. So a lot of mobile phone, data, IoT, wearables, people are willing to share data with their providers. People are willing to share data with the systems. I think this is going to revolutionize what innovation we can bring to the space.
And it's interesting because one is preventative, right? The wellness aspect, as you mentioned, when people are using phones and stuff and trackers, they're trying to maintain their health so they can prevent, going to the hospital for serious more conditions. The first point that you mentioned on the consumer experience, that's interesting because it's becoming a retail experience. What about the digital platform aspect?
Data interoperability and digital platforms is the key to making a lot of these innovations happen. So making sure that data across organization boundaries can seamlessly talk to each other to help make these decisions and seamless transactions is important. Of course, there's an element of consent and data sharing and all that in and around that, right?
All right. So here I want to bring in a question of what we're talking about. when we're talking about customer centricity, the question I have is when we look at GCCs, teams are so far away.
Yeah.
So how do you ensure that customer centricity, everyone is working towards that goal happens? And what are the methods and the means and the proxies to achieve the right kind of outcomes? Because your teams are spread out all across the world. You have to maintain customer centricity for very localized setups. What would you say to that?
First things first, we talked about culture already. Second thing, as long as everybody is aligned to a common goal and a mission and a value realization, then you know you got your first steps right. After that, it's all about making sure everybody has exposure to learning and training systems that are available globally. For example, we have the Learn Anywhere system. Anywhere, anytime, bite-sized. People can log in and create learning curriculums from themselves. We've also launched a VTV, which is a crowdsourced TV platform that we have for people to do.
So it's always on learning for folks at Optum.
Always on learning, yeah, that's what we call it. Always on learning. And
with regards to We Learn TV, what would you say? How does it make the learning experience special?
see, when you have a curriculum-based learning, what you are not able to do is the nitty-gritties and daily challenges that people face. Whether it is what data to use, what is the source of truth, how do I do this analysis, how do I build this toolkit or product. People who are doing this day in and day out have the best nuggets, and these are crowdsourced nuggets that are shared amongst each other. Because they understand the problem of the other developer the best.
So it's real life experience that you bring into the curriculum. Are you also looking at gamification? Because that helps kind of make those concepts stick, especially for new recruits who are joining in. Right?
Gamification, virtual learning, all these are tools that we deploy. I'll give you an example. We have launched a curriculum where we make sure that the call advocates and people who are helping with clinical decision making, other than the curriculum and learning and gamification, they also go through a 2-week program where they work with seniors, the consumers that they serve, which is typically in the age range of 80-85 years, and a day in the life of a senior citizen. And how does this feel? That helps build empathy. So the whole idea is gamification, virtualization, platforms, bringing them closest to the consumer where it matters, building that sense of empathy. And we have a lot of mock calls that we do in a virtual environment to train them for that day.
Harish, beyond engaging with policymakers, I also want you to tackle this whole ecosystem question, right? Because at the end of the day, we are talking about innovation, we are talking about building that talent pipeline, but it requires an effective collaboration between various stakeholders in that ecosystem. How do you achieve it?
I think you are making a brilliant point. I think together we win. Now let's talk about ecosystems. 2 types of ecosystems that we can work with. One is the startup ecosystem. They have a lot of new ideas they want to try out, new techniques, new technology, new products. What they may not have is access to the knowledge of the healthcare business. When we collaborate with them, we are able to bring to the table knowledge about the industry, knowledge about healthcare, what matters to our consumers, what are the problem and pain points. That helps them refine and fine-tune their solutions. And if these two can get together, I think a lot of new ideas and go-to-market generations can happen. Second is with academia. Students, academia is what? Students and the professors themselves. With the students and professors, there's a lot of research projects on future of technology, future of innovation that can be done. The other thing that it does is it prepares students better to be able to understand healthcare and how research, development, new technologies applies in this space of healthcare. It benefits us too in the long run, because then when we hire from the market, we get students who are better prepared to serve the healthcare market, and not just technology hammers looking for a nail, but being able to solve the real problem.
Harish, that's the knowledge sharing aspect, but from the broader business ecosystem, there's more.
Huge gains are to be made through collaboration and networks between startups, between technology companies, between academia, between GCs and the industry at large. I think that can unearth huge unblocked innovation that is available out there.
All right. Before we wrap up, your final words to our viewers on, what advice would you give to technology enthusiasts who are looking to create a mark for themselves in this space?
Look, we talked a lot about consumer today. The one thing, if there is one thing they need to focus on, to ensure that everything they do keeps the consumer at the center and surround the consumer with technology to help make them successful. As long as you can remember that, you can use technology, innovation, learning to the right use. Number two, there are choices to be made in life. There is the short term versus the long term. There is now versus later. There is mission, there is vision. These are choices that you have to make based on your passion, your drive. Last but not the least, healthcare is really growing at a fast pace. This is an industry that has a lot of complex problems to be unearthed and solved. There is no better place to be able to make an impact to people, communities, and societies around you.
All right. Well, words of wisdom from leaders in the business to enable you, the viewer, to make the right choice. Harish, thank you so much for joining us.
Thank you very much, Gautam. It was a pleasure.
Well, that was Harish, and he shared his valuable insights on the evolving role of global capability centers and their impact on the healthcare sector. His perspectives on how Optum India is driving innovation, enhancing delivery efficiency, and leveraging advanced technologies have been enlightening. It's clear that GCCs are not only transforming traditional business operations, but are also becoming pivotal in fostering a culture of continuous improvement, innovation, and strategic growth. His leadership and vision are truly inspiring, and it's evident that Optum is at the forefront of healthcare innovation, contributing significantly to the industry's progress. Well, that's it for this special presentation brought to you by Mint. I'm your host, Gautam Srinivasan. Thank you to all the viewers for tuning in. Till next time, have a great day.